Hi, this is a video on postpartum care. My name is Emily O'Connor. I'm an SHO in obstetrics and gynecology and on year 2 of the MSc program. One thing I wanted to start with was taking a postpartum history, as I feel this is an area that isn't covered greatly and people often don't know where to start. So when I hear a postpartum history, I first of all want to know what day of the postpartum period they're in, what baby number it was for them, so first, second, third, etc. I also want to know the type of delivery that they had. And I want to know what gestation they were at. These are all important questions for the state of the mum and the baby in the postpartum period. I want to know whether their labor was spontaneous or whether they had an induction of labor. And if they had an induction of labor, I want to know why. Finally, I want to know any intrapartum complications that they had during the labor or delivery process. The next part of the postpartum history. So first of all, in the next part of your history, I want to know how the patient's doing at present. Just a one-liner on her general state of well-being. And then when moving on to the rest of the postpartum history and exam, I like to think of it from head to toe. So starting at the top and working your way down through all the different things that you need to think about to ask the patient. Now, there's a reason that this next part is top of this list, because mental health is a really important aspect of the postpartum period. Approximately 50 to 70% of women develop symptoms of baby blues at some point. Postpartum depression occurs in 1 in 7 women, and it's more likely to occur if they have a history of mental illness previously. And puerperal psychosis occurs in approximately 0.14% of women. Next, moving on to their breasts. I first want to know, are they breast or bottle feeding? This is important, as breastfeeding should be encouraged at every possible opportunity. And specifically, symptom-wise, I want to know about any erythema, any masses present, or whether there's any areas of tenderness or soreness, as this all might be indicative of mastitis, which needs to be treated with antibiotics. Moving on to the next part of the history and exam, I want to know about their abdomen. Their uterine fundus should be palpable below their umbilicus. It's important to palpate the postpartum abdomen in order to determine where the uterine fundus is at. I want to know whether they have any pain or after pains which are associated with oxytocin release during breastfeeding. I want to know if their bowels are moving regularly and if they're passing urine adequately. And if so, are there any symptoms of a UTI or constipation, both of which are easily treated. I want to know about their lochia, so 4 important points: the color, the amount, whether there are any clots present, and whether there's a bad odor, as heavy bleeding and clots can sometimes indicate signs of an infection. Finally, moving on to their legs, I want to know, are there any signs of a DVT and whether or not they're on INAHEP. If they are, why? Contraception is another hugely important area in the postpartum period that is often overlooked, especially by doctors. Every woman should be on contraception by 4 weeks postpartum, and ideally this should be discussed in the antenatal period, but definitely in the postpartum period. So when thinking about contraception for women in the postpartum period, I want to start with these items in green. The intrauterine device, such as the Mirena coil or the copper coil, is probably one of the most effective methods of contraception. The failure rate is less than 1 per 1,000 users. A contraceptive implant like the Implanon, which is a progesterone contraceptive, has a similar failure rate, and patients don't have to worry about taking it. Sterilization is also an option. However, the failure rates are significantly higher, and this procedure is not without its morbidity and mortality, especially in women who opt to have this done electively. The items in yellow, progesterone-only pill, the progesterone depot injection are also suitable, but probably less effective than the green methods, as their failure rates are higher, and women have to remember to take those things. The combined oral contraceptive pill is another one that is suitable, but some caution is advised, as it's recommended not to start this until day 21 of the postnatal period due to increased risk of venous thromboembolism. This next one is intentionally last and in red because it's probably the least effective method of contraception out there, and women should be discouraged from using this as their sole method of contraception. For breastfeeding women, the only thing that varies is that they should avoid the combined oral contraceptive pill until at least 6 months postpartum. There are a couple of other things that I want to consider in the postpartum period. One of the first things is the rhesus status of the patient. If she's rhesus negative, she may need anti-D in the postnatal period if her baby is rhesus positive. This is routinely tested in all new mums. It would be a good idea to know her rubella status as well, as there's a significant proportion of women out there who are non-immune and require MMR vaccination in the postpartum period. It should be noted if they require any follow-up visits with physiotherapy or with the obstetric department. It's really important to emphasize their 6-week check with their GP, as it's been shown that attendance rates can be as poor as 40% for this very important appointment. Blood pressure monitoring should also be considered for those who had any issues during the antenatal or intrapartum period. They should be instructed on when to attend their GP for their next blood pressure check. OGTT is something that's often forgotten about and should be repeated 6 weeks postpartum for all women who were diagnosed with gestational diabetes during the pregnancy. There are some postpartum complications that are reasonably common. I'm not going to go into in detail in this video, but we will mention some of them. Endometritis is an infection of the lining of the uterus, and we mentioned this in terms of symptoms earlier. UTI, wound infection, and episiotomy or perineal wound infection are also commonly treated in the postnatal period. One should always be vigilant for DVT and PE. Women may experience incontinence, both fecal and urinary incontinence, in the postnatal period. This should be monitored for, as they can be seen by physiotherapy and arranged to come back to the outpatient department. Some women describe pelvic or perineal pain. This can also be referred to the relevant physiotherapy department. PPH can occur at any time in the postnatal period, and mastitis is also commonly seen. These are the references used to make this video. Thanks for watching.